Welcome to the Euvie Podcast. Today we're here with Dr. Borders to ask her some questions about the field of gynecology and obstetrics. So Dr. Borders, the first question I want to ask you today, or the first few, are about the reproductive system and about the treatment and diagnosis procedures. So the first question I want to ask you is, why do most cervical cancers start in the transformation zone?
So the reason that they start there is that's where the HPV virus infects the cervical cells. The transformation zone is an area between the outside of the cervix and the inside of the cervix, and there's a change in the type of cell that's there, and that's where the HPV virus, which is the virus that causes cervical cancer, infects the cells and begins to multiply.
So one of the ways to help prevent cervical cancer is by avoiding exposure to HPV?
Yes.
Okay. And moving on to tubal sterilization. So there are a plethora of tubal sterilization techniques, such as the Pomeroy technique and the Aldridge and the Uchida technique. So what technique would you use?
So actually, there are two forms currently. I guess three, if you think about it, of tubal sterilization that exists. The first is done at the time of cesarean section, and some women choose that as an option. The other two that are done outside, and then I guess the second would be after a vaginal delivery. Some women have what's called a postpartum tubal sterilization that is done in the hospital prior to discharge, and many times that's done with the Pomeroy technique. The other two that are more commonly encountered in my field are one that is done hysteroscopically, meaning with a camera that goes through the vagina and through the uterus, placing coils called E-shore coils into the openings of the tubes. Those coils then cause scarring, and the tubes scar off. So that's one option. The other option is what people think of as a standard tubal ligation. And that is done in the operating room via the laparoscope. And so an incision's made in the belly button. And then either clips, which are called Filshie clips, are applied to the tubes, crushing them and not allowing an egg or sperm to pass through. Some people still use cautery techniques. Finally, a final option is actually removing the tubes completely, and this is typically done in women over the age of 30, and there's a thought that that would prevent ovarian cancer in the future.
Oh, okay. What are some complications that could arise with these sterilizations?
So probably the biggest risk of tubal sterilization is the risk of regret. It is considered a permanent procedure, and especially when performed under the age of 30. Later on, women may have different life circumstances and wish they were not sterile. The other risks are common risks that go along with surgery: bleeding and infection, damage to organs in the belly that may require further hospitalization or surgery. And then finally, there's a risk of ectopic pregnancy. And ectopic pregnancy is a pregnancy outside of the uterus, and it can be life-threatening. And when you have had a tubal ligation, while your absolute risk of pregnancy is low, there is an increased risk of ectopic pregnancy compared to the general population.
Oh, well, you mentioned that for women under 30, the biggest complication for a tubal sterilization is regret. When is the right time for a tubal sterilization, would you say?
I don't think there is an exact age as far as the right time. I think that is a different answer for every woman, and something that has to be an individualized decision between a patient and her doctor. I think you need to be 100% sure that you don't want any more children, and not willing to use other forms of birth control that are maybe long-acting and just as effective as a tubal.
If a woman does become pregnant, would you use a cervical cerclage or a vaginal progesterone to manage a short or insufficient cervix during pregnancy?
So that's actually a really complicated question and one that, again, would be individualized on a patient. Neither of those are commonly used things in the general pregnant population and are reserved for very high-risk pregnancies and are based on, most of the time, based on a history of a prior pregnancy complication. Occasionally, they're based on a first pregnancy, but it would really determine, there would be lots of factors that would determine that, and we would do it in consultation with maternal fetal medicine, who are the high-risk obstetric doctors.
Okay. And for a woman who isn't pregnant, let's say she has a disease such as endometriosis, why are those diseases so difficult to treat?
So I think endometriosis is challenging to treat because it does not have a classic appearance in every person. It's also not something that I can see visibly in the office or run a test on in the office to know that someone has it. The only way to formally diagnose endometriosis is to do surgery and do a biopsy and have a pathologist look at that sample and say, yes, this is endometriosis. So I think that makes diagnosing it hard. The other thing is that endometriosis many times has pain as a component, and pain is a very difficult thing to treat as well because everybody's pain is different. And again, I don't have something that I can test how bad the pain really is and that type of thing.
Okay, thank you. So for breast cancer, because breasts change in size and texture during the menstrual cycle, when is the best time to perform self-exams for breast cancer?
So there's actually a big debate going on in the medical community about whether monthly self-breast exams are actually necessary. They haven't been shown in large studies to actually save lives. While they have been shown to increase detection of lumps, both benign and malignant, they haven't been actually shown to decrease mortality. And so some organizations would recommend not even doing them. However, I think it is a good idea to have a good understanding of your own body, including your breasts, and so that you are aware of what normal is for you and would then be aware if there are changes. Probably the best time, if you have regular periods, would be to do it at the end of a menstrual cycle, so the end of bleeding, because the breasts are less swollen and tender at that time, and it gets you in the habit of doing it once a month. For people that don't have regular cycles, meaning monthly cycles, you could pick a time each month, the 1st, the 15th, the 30th, whatever works best for your schedule.
So also during menstruation, toxic shock syndrome is a huge fear. So how common is toxic shock syndrome actually? How worried should the general public be about it?
So it's actually not very common. I think it happens between 3 and 4 people per 100,000 tampon users. It's a statistic I'm aware of. And so it is a terrible thing and very complicated and scary and dangerous when it happens, but it's not that common. I think it's something that people should be aware of so that they are changing tampons regularly, but not something that needs to prevent someone from using tampons.
So we're going to move on to questions about life stages and just general advice. So recently a study came out and it said that girls these days are starting their periods earlier and earlier. Why do you think that could be?
So there has been a trend that menses are starting earlier in girls. And I don't think we have an exact answer. Part of that could be that compared to 100 years ago, nutrition is better. And so we're developing a little more quickly because our bodies are in a better place to do that. Another, thought is that maybe we're exposed to exogenous hormones, either from food or the environment. And so I think probably a combination of the two is really what the true answer is. I don't know if we'll ever find the exact reason.
Mm-hmm. Well, to these girls who have just started menstruating, what would you tell them? Is there any advice you'd give them?
I think, number one, to have a good relationship with their mother or their female caregiver, if there is one in the house, so that they can ask questions. I think to know that it's normal and there are, millions of people around the world experiencing the same thing that they are, and to do their best not to be embarrassed about it. I think it's a good idea to have a change of clothes as well as sanitary products in their backpack or locker or available, because especially at the beginning, in the first year or two, their periods can be erratic, they can be heavy, and accidents can happen.
On the other end of the spectrum, how would you help older women better ease into menopause? What would you tell them?
So, I haven't experienced menopause yet, so that makes this a little more challenging. But in the patients I see, I think being prepared for it, again, talking to friends and family members that have been through the transition, understanding that there is not a textbook course that it takes, and it is different for every woman that goes through it. And having, if in a relationship, having an open discussion with their partner about the changes that are happening, how they're feeling, that type of thing. And talking to their doctor about what they're experiencing, because some things are managed with lifestyle changes, some things are managed with medicine, and that, again, is an individualized treatment.
So, because there's so many things in obstetrics and gynecology that are individualized, as it is with most fields of medicine, what are the most significant lifestyle choices from person to person that affect the reproductive system, like stress or smoking?
Yeah, I think the two that I would pick would be smoking, as you mentioned, because that is the number one, I think, modifiable thing that women can do to improve their health, is to stop smoking or never start. Smoking, it actually increases your risk of cervical cancer, as we talked about before. It increases your risk of infertility and other problems during pregnancy, preterm delivery, small babies, babies having to go to the NICU after delivery. And it also increases your risk of problems later in life, heart disease, strokes, high blood pressure. So I think that's the number one thing. The second thing, I think, encompasses a lot, just having a healthy lifestyle with healthy eating, exercise, stress reduction. And I think while those may be stressful things to initiate, once someone makes them a part of their daily life, it actually significantly improves their overall health.
Okay, thank you, Dr. Borders. And now I'd like to ask you some questions just about society as a whole. So, how would opening up about the reproductive system help the reproductive health of our society as a whole?
Oh, that's a great question. And I don't know how we would accomplish that, but I think just trying to get people to be more comfortable talking about things that are naturally occurring and understanding that it happens as a part of our bodies and growth and lives would probably make things a little smoother in society. There are a lot of barriers to women, and not that the reproductive cycle is the basis of all those, but I think some awareness and less stigma attached to it may help us in the future.
So you mentioned before that HPV helps or at least causes cervical cancer. So why do you think there has been such a backlash against vaccines such as Gardasil that help protect people from HPV?
Yes, that is a great question. So HPV actually is the virus that causes cervical cancer. That has been proven, and it is a fact. And unfortunately, HPV is sexually transmitted. And I think, as your prior question suggested, the part of it being sexually transmitted is what is causing the backlash. I think, we as society want a cure for cancer. And while we don't have a cure for cervical cancer, we have a way to prevent cervical cancer, but it's not being taken up by society because of this word sex that's involved in it. And I think parents are concerned that giving their child this vaccine would then make them sexually active or sexually promiscuous, which has not been proven in any study that has been done of this vaccine. And so I hope, and I think there's also just a general trend of against vaccines in general, and so that may have something to do with it. But I hope that people realize that this is a way to significantly reduce their daughter's chance or their son's future partner's chances of developing a curable disease.
Well, finally, if you could, how would you reach out to the general public to help educate them about the female reproductive system?
Gosh, that is a good question, too. I think by talking to people like you and encouraging others to make people aware. I try to educate my patients, when I have them in clinic, and talk to friends and other people when they have questions. I think probably my biggest thing that I would promote is access to effective contraception, especially for teenagers and young adults, because I think that access and then and subsequent uptake of that method of birth control is very helpful in society. So.
Okay, thank you for your time, Dr. Borders.
Oh, you're welcome. Thanks for having me.
Oh, thank you. Okay, bye. Thank you.
You're welcome.
And thank you for listening to this episode, this very special episode of the Euvie Podcast. We hope to talk to you another time. Thank you.